and welcome to our menopause question and answer session. My name's Rachael and I work for Starting Point Community Learning Partnership in Woodley, and we're joined today by Grace, who is one of the doctors at Alvanley Family Practice. So welcome, Grace.
Thank you.
So today we've got some questions, some general questions and some questions from a post on Facebook, and Grace is here to answer those questions. So welcome. First of all, what is menopause? What is the menopause?
Menopause is 12 months after your last period, but I think a lot of people would agree that it's a lot more than that, and there's a lot more involved, and it even starts before the menopause with your perimenopause. I think the next question was about perimenopause, am I right?
Yeah, I think well, I'm 38 and I think I don't know enough about the menopause. Learning the processes behind this policy has made me really think that this is something that might affect me soon. So what kind of things can I expect to experience potentially coming up to the menopause?
Yeah, so perimenopause is different for everyone, and for some people it's few months before the periods are going to start, but for some women it can be years, and there's lots and lots of different symptoms. They all come down to changes in your hormones. So your estrogen is getting lower, and that's what causes a lot of different symptoms. So there can be so many different symptoms. It's absolutely not just hot flushes. That's all one knows about, but there's so many other things. So night sweats as well as hot flushes. Then problems with sleep. So many women just suddenly stop being able to get to sleep or stay asleep, or they're waking up early. They feel completely fatigued. There's a huge amount of women who come with anxiety and depression that have never presented before to the doctors. So that's probably one of the most common presentations. And then you can get joint pain, muscle pains. I get loads of women coming to me saying, I think I might have early onset dementia, because they've actually got problems with their short-term memory. They go into a room, they're not sure why they went there, they try to think of a word, it won't come to them. They went to the shops, they don't know what they're buying, and actually it's perimenopause. You can also get symptoms down below, so you can get a lot of dryness, and that can also lead to recurrent infections. So some women might find they keep getting thrush, or they keep getting a urine infection, and also a big loss in sex drive. So it's massive, really. The amount of different symptoms you can get and how far-reaching that can be in all aspects of your life. And it can affect a lot of women at home, their relationships, and at work. And there is things we can do. So
great. Well, that's great to hear, and finishing with the positive there. And also one of the things we was asked is that a member of our community said she was 34 when she experienced the menopause. So what's the average age that people experience it?
In the UK, the average age to go through the menopause is 51, but it can be a huge range, and it's normal, to be before that or after that. Anything before 45, we'd say, is early menopause, and anything before 40 is really quite early. And if you're going through if you've got those kinds of symptoms and you are below 45, and 100% if you're below 40, you should chat with your GP, because if you go through the menopause a lot earlier, that means your body's exposed to those changes in hormones for longer, and means that you probably really would benefit from treatment.
Thank you. So another question that we've received is from Kay. She said, have you got any tips on getting a good night's sleep? She feels tired, but it takes her ages to drop off, and then she's no sooner woken up with those hot night sweats that you mentioned. So have you got any tips?
Yeah, so there's a few things you can do. There's things that may or may not seem obvious. So keep your room that you're sleeping in cool. It's a lot easier to get to sleep in a room that's cool rather than too warm. And ideally you want it to be about 18 degrees. So you can, get a thermometer in your room and make sure that you're getting it that low. Avoid so things that can set off hot sweats more are alcohol, caffeine, spicy foods. So trying to avoid those things, and also avoid having hot drinks before you go to bed, because it can, pop your body temperature up. keep your routine as much as possible. Our brains like us to have a regular sleep routine. And so if you're doing different things every night, going to bed at different times, getting up at different times, doing different things, it can be really difficult. Whereas if you can keep, you go to bed at a certain time, you get up at a certain time, and in that little bit of time before bed, like the hour before, you have a routine, you listen to music or an audio book or something ideal that doesn't involve screens, because screens set off, give like a certain light that tells your brain stay awake, don't have good sleep. So having that bit of time without screens, doing something relaxing and keeping the routine the same, they're all things that can really help. And then moving on from there, HRT helps massively with night sweats and with the sleep. And there's a particular sort of formulation of HRT where we use a certain medication, and that's taken at night, and that really makes people feel a bit sleepy and can really help with the sleep, getting through the night. So they're the sort of other options if those initial changes don't help.
Thank you. So Kyla has asked, I think we referred to this earlier, how long is the peri-menopause period, and how does that differ from menopause itself?
Yeah, so perimenopause is before your menopause. So you're still having periods at this point, but they might be becoming irregular, and you're getting all those symptoms that I talked about before. Menopause is you haven't had a period for a year, then you're classed as menopausal, although you still might have some symptoms from the perimenopause. And yeah, you're right, I said before, it's completely different for every single woman. Some are a few months and some can be a few years.
Okay, thank you. We've also had a question from Nicola. It would be useful if we could learn about surgical menopause and alternatives to HRT. So who would be affected by those circumstances?
So surgical menopause can happen in a few different situations, and it's basically something medically has been done to make your body go into menopause. And so it's not happened, naturally over time with changing hormones. It's generally can be a bit more of a sudden thing. So women that have had surgery to remove their ovaries, and also even sometimes women who've had a hysterectomy, even if they've had their ovaries left in, that can be enough to sort of trigger off the start of the menopause and the hormones not being produced enough. And there can be some other causes as well. So people who've had radiotherapy to their pelvis area, certain kinds of chemotherapy, and some ladies as well who might have things like severe endometriosis or like PMS, PMDD, sometimes go on quite powerful hormone treatments, and that brings on a menopausal state as well. So all of those could technically be classed as surgical menopause, but I think the main difference is, something medical has made it happen. In terms of alternatives to HRT, treatment might not be for everyone, and there are some people who it might not be appropriate for. There's quite a few things that we can do. So there are antidepressant type medications are actually can be really, really helpful for hot flushes and night sweats, which you wouldn't necessarily think, but they have some side effects with them, as a lot of medication can. They can give you an upset tummy, make you feel a bit anxious, but mostly that can settle down after the first couple of weeks. Other options that we've got, so talking therapies, and particularly CBT, which stands for cognitive behavioural therapy, that can be helpful with the sort of anxiety, stress and depression that people can experience. Times gone by, there was a medication called clonidine, and some women still are on that, which is sort of relating to it's not really that good. So we don't tend to start it that much anymore, but there might be some women that are on it now that have been on it for a long time and it works for them, and they're staying on it for now, and that's fine. And it's also the lifestyle changes that can really help. So being active, can be really good, help your hot flushes. It improves your mood because it releases like a natural antidepressant. It's also good for your bones because you've always got to think about your bone health, menopause, because that can be the time when some women can get like thinning of the bones, and the more exercise that you do and load weight through your bones helps keep them stronger. And again, as I said, with the sleep, similar things to that. So, you know, avoiding alcohol, caffeine, spicy foods, those kind of things. Now, there are a few things probably to be a bit careful of in terms of alternatives to HRT. So, sort of herbal supplements, you know, things that you can buy in health shops or online, just to be careful of them, really. You know, a lot of them haven't got a lot of evidence. And also when you're buying something, you know, online or something, it's not possible it's not been properly regulated as to what's gone in it. The other thing to be wary of is, because you can buy stuff like this online, what people call bioidentical HRT, and they sort of advertise it as, oh, you know, this is all natural, been, you know, extracted from plants and everything. Again, if you're buying something that's a bioidentical HRT, it's probably not been regulated, and so you don't know what dose of hormones are in there, are they the right ones? So just say to be careful around those things.
Yeah, definitely. So the importance of seeking professional help,
Yeah,
and speaking to your doctor of options that don't necessarily include HRT.
exactly.
Yeah. So what is HRT then? Because I've heard of it, but I wouldn't be able to tell you what it is.
Yeah, so it's a huge topic. So it stands for hormone replacement therapy, and basically what you're doing is you're replacing what's low in the body, and being low in the estrogen, that's what's giving you symptoms. And so effectively what you're doing is you're just replacing that, and it's really, really effective. That's the first thing to say about it. You know, most people that we put on HRT feel great. You know, sometimes we have to make little changes, but it really is quite effective, especially with the hot flushes, night sweats, and with that sort of anxiety, depression side of things. Most women will have two hormones when they go on HRT. The estrogen is what helps their symptoms, but they also need a progesterone, and that is just to basically protect their womb, because if we gave loads of estrogen without anything else, the lining of your womb gets very, very excited by that and grows a bit too thick, which can be a worry. So as long as you've got the two hormones, you're safe from that point of view. But some women who don't have a womb, they've had a hysterectomy, they don't need the other hormone, so they just have an estrogen replacement. There's lots and lots of different forms of HRT out there, so you know, it's absolutely talk to your GP about it. There is, and this is where it's really tricky, there's a body identical HRT that we do prescribe, and that's different from the bioidentical HRT, which you can buy. So just to be clear between those two. And the body identical HRT is all, you know, the exact hormone that your body is missing. So some women find that really good for symptom control and for reducing side effects. There's a few probably risks and things to talk about with HRT, and a lot of women might think, oh, well, you know, I've heard a lot of bad things about HRT, what about breast cancer and all those things, so I thought I could just talk about that a little bit. So there's two key risks with HRT. One is your breast cancer risk. Now, there was a lot of studies that were, you know, published a way back, which maybe weren't very good studies in the way they were run and the way that the results were put out. They've done a lot more studies now and realised that the breast cancer risk is nowhere near what it was put out to be then. There is still a slight increased risk, but it's not as much risk as somebody who drinks 2 glasses of wine at night, and it's not as much risk as somebody who's obese. So there's a small increase in the risk of breast cancer, but it's not massive. So, you know, for some people, if they've got a very significant family history, that might be something to, you know, consider. If they're also obese, or, you know, they drink extra alcohol, things like that, it should all be taken into account. And when you speak to your doctor, they should weigh up, you know, the pros and cons with you and help you come to the decision of what's best for you. The other key risk with HRT is blood clots. So you might hear people say about DVTs, which is clots in the legs, and there's also clots in the lungs. And it's basically just because of the hormones makes your blood a bit more able to clot. That risk is there. So if you've had a blood clot before, you need to discuss that with your doctor who's starting you on the HRT. That you can get around this risk because you can use HRT. If the estrogen part goes through your skin, it reduces that risk back down to normal. So it's not necessarily a blanket no for people who've got risks for blood clots. That's probably enough about HRT because it's such a huge topic. You could talk about it so much. I think the only other key thing to say about it is it doesn't provide contraception. So you might still want something like that. And a lot of the contraceptions are fine to have with HRT.
Brilliant. So I think the main thing I'm taking from that is that every circumstance, there's different options, different things you can try, and having that honest conversation with your GP will get the best one for you. Brilliant.
Yeah, there's so many things to take. So say, for example, you're otherwise well, but you suffer with migraines. A lot of women find that their migraines are set off around perimenopause time. If they take a tablet, HRT, their hormones might go up and down, and it might set off the migraines even more. Whereas if they go for something that goes through the skin, like a patch or a gel in combination with a capsule, the headaches might be brilliant. So it absolutely is an individual thing to discuss. And, you know, if your GP is ever not sure, then they can write off, there's a specialist menopause clinic in Stockport you can write and get advice on that.
Brilliant. That's great to know. So just coming to a conclusion now of our chat, have you got any tips for people to support anyone they know who's experienced? It could be a family member, a friend, or someone at work. Do you have any tips or things to bear in mind for us to be aware of?
I think the most important thing is to be supportive and listen to them, because it is a horrible thing to go through for some women. You know, some women are fine, but some women find it really, really difficult. They have severe symptoms, they're struggling with the mental health, which has not happened to them before. And it's also tends to be a difficult time in people's lives where they've got children, but they've maybe got parents as well to look after. You know, there still is important. You know, I think if it's like someone at work, you know, encourage them to speak to the employers and see, is there anything that can be done to help them? Like, can they have any changes to their uniforms or their workstation that would help them? Do they need to have little breaks, you know, to go and get a bit of cooler air, or, you know, things like that. And I think encourage that, you know, if they're struggling, encourage them to go and see the doctor and have a chat about what options are.
Yeah, brilliant that they're not on their own. So where would you say, apart from your GP, is there anywhere you recommend that's got good information and advice?
Yeah, so there's an app called Balance, which you can get on your phone, and that has got fact sheets on all innumerable topics. It's got videos of healthcare people talking about different options. Also have a look at the British Menopause Society website, and there's another good one called Rock My Menopause. On any of those, if you have a look at Green Score, or I think if you're on Balance, it's called Menopause Symptom Questionnaire. You know, if you're wondering, oh, could this be me? Fill it out and have a look. It's just, you know, symptoms and how much you think it's happening to you, and it will give you a score, and that can be useful when you know, if you're going to go to your GP, you can say, well, I've got this score, and it, you know, it might show you that you are struggling more than what you thought, or, you know, it's a useful thing to do, and it can be helpful to see if you do have any treatments or make any changes. It can be helpful to do it again and look back and think, oh, well, I've improved that and I've improved that.
Brilliant. Well, we'll try and
put have a look at that. And
I will put some links to the apps and pages that you've mentioned when we post this to our social media page. But I just wanted to apologise for any technical problems. We've had a few problems with the internet, but hopefully we've answered the questions that were submitted. And as Dr Wilkinson said, if you've got any more questions, don't be scared of speaking to your GP to get more help and advice. So thank you very much for joining us today.
No problem.